What's going on, everyone? Happy Wednesday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Wednesday, September 11th, 2024 Pandemic Update. If you're new to my channel, welcome to my channel. This is where I do the daily pandemic update on not only just COVID levels and COVID information, but cases of other viruses as well. And we're going to be talking about several different viruses today. Measles is popping up quite a bit once again, and RSV is starting to show up in wastewater in some parts of the United States. I'll be showing you that as well. And of course, yes, we will take a look at those COVID levels. So if you're new to my channel, subscribe down below. Give this video a thumbs up. Let's try for 200 like button hits today. Share this video with anyone you know. Hit that notification bell and leave your comments down below. Quickly, before we get started today, we have to remember something. 23 years ago, on September 11th, 2001, there were a series of terrorist attacks in the United States. And we just must not forget what happened during those attacks. If you were alive back then, I'm pretty sure you know where you are during that point in time during the day. I remember where I was. I was dismissed early from school. I was coming home from school. Didn't know what happened until I got home. Didn't know why were we being sent home early from school. Then when I got home, I saw on TV what happened on September 11th, 2001. So let's not forget what happened on that day. All right, let's get to today's update because we do have a lot of news to talk about today. First off, we do have a positive for COVID announcement, and this one comes from United States Secretary of Treasury, Janet Yellen, has tested positive for COVID yesterday on Tuesday, September 10th, 2024. It was another evening announcement, much like what happened with Eric Adams. Seems to be the theme this week. That's 2 in a row. Will we have one today after I post this update? I don't know. But currently she is 78 years old. And this was the first known case I could find of her. I checked some of the sources I use. She wasn't coming up. So this is the first case that I found for her. Moving on now to this. This was breaking as of last night, I believe. U.S. Representative Joe Wilson, Republican of South Carolina, was taken to the hospital after collapsing at an event. And I'm hearing that he may have potentially had a stroke. I don't know. Last I heard, he's still hospitalized. I have not seen any update on this today. But as you know, with cases like this, curiosity gets the better of me, as does a lot of other people. I see this on social media quite a bit, at least in the COVID cautious community. Did they ever have a case of COVID? Well, I went to govtrack.us, which stopped tracking, I think, in late 2021. Yeah, eventually we'll be adding all these cases from their website onto my archive, but it's going to take a very long time. It'll probably be a couple years before I even get that done. But checking here, I am going to add Joe Wilson's case because he had one. Back on December 16th of 2020, he did test positive, and he was in isolation until the 30th. Remember, back in those days, it was a 14-day quarantine period. And if you click on the news story, which I did earlier, it does say that he was having very minor to no symptoms at the time. He was feeling fine, is what it was saying. But we do know he has had COVID in the past. I'll make sure I add his case and then put a second post within that stating the current case of what's going on, because I do like to keep an archive of the health of our elected officials. Alright, moving on to something that's going on in California. And that is a COVID-19 outbreak that is affecting Mariposa County hospitals, officials say. Yes, a small COVID-19 outbreak is affecting a hospital in Mariposa County, according to Mariposa County Health and Human Services. So yes, COVID outbreaks, they're still happening, even though California has peaked. All right, we do have several measles cases to talk about here. First, there was one that was confirmed in Tennessee. It says the Tennessee Department of Health has confirmed a positive measles test of a resident who recently traveled internationally, spent time in Kentucky during the infectious period, and is now recovering from the virus. The Tennessee resident is a student at Western Kentucky University, according to the Barren River Health District and the Kentucky Department of Health. And of course, the next story here, it just pretty much follows up what we know here it's a student of Western Kentucky University. It's at least one case so far. Hopefully this doesn't grow to more cases. Many of the times it has not, and then some of the times in some states it has grown. Like Oregon, Minnesota. Back early in this year, or late last year, Philadelphia had an outbreak that grew to more than one case. So we'll have to keep an eye on that. Sticking with measles for just a second, or excuse me, moving on to mpox now. I thought we had another measles. Okay, it's mpox now. This time mpox cases are on the rise in Canada, and if we come down here, it says as of mid-August, 164 cases have been recorded in the country this year so far, and that is the highest numbers that they have seen in some time. And it does say here that clade 1 strain has not been detected, or we know it hasn't been. It's only been in just a few countries so far, and I have not seen any new reports about clade 1 cases. All right, Alberta, Canada. Their COVID-19 death toll more than 4 times higher than flu over the past year. 732 Albertans have died due to COVID-19 since last August. So, I mean, that's a significant number still. That's relatively concerning. UK, we'll get an update on that tomorrow. Last week, UK saw just a minor rise in cases. We'll get a new update for this week. Once again, that will be tomorrow. Heat-related illnesses. They're still a problem in the U.S., and they're going to continue to be until heat finally subsides across much of the United States. Believe it or not, there's still just a few counties in the Northeast still having problems. Mid-Atlantic, we'll say Virginia down into North Carolina, quite a bit of problems. Florida still has problems. Look at the Great Lakes. There's just a lot of heat-related illnesses in the Great Lakes at this time. Oregon is continuing to have problems, as is the Southwest. It's still very hot in the Southwest at this point. Let's take a look at today's pollen levels. 28% of the country is in medium status, and you can see there's red in Texas, Oklahoma, Kansas, Arkansas, Iowa, Illinois, Kentucky, Tennessee, Alabama. Even portions of Mississippi is in the red for pollen levels at this time, and even a couple counties in New Mexico are in the red. Let's see what's going on with air quality levels. Hopefully we won't find that they spread more east. I'm afraid we probably will. Yeah, they're starting to spread a little bit more to the east. I'm concerned. I've been watching the models. I'm concerned that could come down. There's going to be an area of high pressure that comes down from Canada. That could bring some of this bad air quality with it, spread it into the Great Lakes, maybe even portions of the Mid-Atlantic and Northeast. And take a look at this. Los Angeles, you've been continuing to get worse. Arizona is starting to have problems. Utah suddenly is having problems. Idaho still has problems. Oregon, parts of Washington, Montana, North Dakota, South Dakota, Minnesota, and southern portions of Canada are all having air quality problems at this time. Not a good thing. Let's take a look at this now. Climate Data Report is my place for weather and climate over on X. Haven't gotten to there much. I promise I'm going to get there this evening because there is Hurricane Francine that is ongoing in the Gulf of Mexico. Yeah, look how far behind we are on tweeting on that. We're going to get to that after I'm done with today's update. Philadelphia Fire Department yesterday, and actually we need to update this. It's over 800 yet again. Here it is. 804 was the number reported on Tuesday, September 10th. Not a good number. And speaking of being busy, earlier today I saw something that I did not like. Take a look at this. This was Chester County, Pennsylvania at 1:16 p.m. There was not one, not two, not three, not four, but 5 sick person calls at a time. That's quite a few. And at the same time, Montgomery County had 4 respiratory calls at that point in time. So that is not good either. Let's do a live look in and look at this. Remember, those are counties in Pennsylvania. Here's a live look at Montgomery County. We see there's currently 3 respiratory calls. And how about what's going on? Wow. Look at Chester County, Pennsylvania. Just loaded with various different types of calls right now, including sick person, diabetic emergency, unresponsive person, respiratory difficulty, stroke. And stroke and cardiac arrest on both Montgomery and Chester County CADs. It's been showing up a lot more lately. I don't know whether it's because of post-COVID from this current wave that's still ongoing. I just don't know. But the last couple weeks, I've been seeing way more strokes and cardiac arrest being reported here on the CAD. Not good to see more calls for that type of call. All right, taking a look at what's going on in Canada for today. And let's see here. COVID viral activity level is moderate at this time. The viral activity level for flu A is low. The viral activity level for flu B, not detected at this time. And the viral activity level for RSV is low at this time. All right, Walgreens this week, 29.9% positivity rate for COVID. That's down by 3%. Last week was 32.9%. Total tests, 10,030. The prior week was at 13,537. And you know what? Let's take a look at a few states here, just a couple. Missouri this week was 24.9%. The prior week was 32.6%. That's down by 7.7%. Total test, 229 versus 298. Arkansas this week, 24.4% positivity rate. The prior week was 23.4%. That's up by 1.1%. Testing was down, 90 versus 107. Oregon this week, nope, Oregon did not report. How about California? California reports 32.4% versus 35.9%. Difference of down 3.5%. Total test, 377 versus 518 this week. All right, let's take a look at some CDC data here, shall we? And the latest variant of COVID that is causing trouble is the KP.3.1.1 variant at this time, which is dominating. Not sure why it's not showing the actual amount. There we go. It is at 42.2%. We will get a new update on that in the near future. When we take a look at epidemic status for COVID across the United States, we can see here there are a lot of places that are likely declining or are declining at this point, but some areas are still growing. West Virginia is still growing, Michigan, South Dakota, Idaho, and even portions of Washington are still growing. Likely growing, Montana and Utah. California is likely declining, as is Mississippi, South Carolina, Virginia, New York, and Maine. And declining, where it's, COVID is definitely dropping at this point, is Illinois, Indiana, Connecticut, Tennessee, Alabama, Georgia, Florida, Louisiana, Texas, and portions of New Mexico. And then the rest of the country, there's a lot of undecided areas at this time, which that's not good. That means we're just not seeing enough data from those areas. All right, I want to show you something in wastewater. Take a look at this for the South. Now, the COVID levels are dropping at this time, but take a look at this. RSV levels. Yeah, multiple updates now where RSV is starting to rise. It could be the early stages of RSV starting to rise. Influenza A is seeing small rises. Influenza B is still low. So I would consider, it's totally up to you. If you know someone who needs the RSV vaccine, I would consider start thinking about that in the South. And influenza A and influenza B is still low. They're both still low, but I would start thinking in your head, you know what? Maybe it's time to get that flu shot relatively soon. And HMPV, not much of an issue. Look at norovirus here. Norovirus in this region, it's seeing a pretty hefty rise at this time. Let's see what's going on in the West Coast. Hopefully we're not having the same problems there. In the West Coast, COVID levels are medium. They're still dropping. RSV is lower than the South, and it's actually dropping once again. Very low levels of that. Influenza A, Influenza B, HMPV, all low at this time. Norovirus is medium. Just a slight rise ongoing at this time. And we might as well check the other regions. The Midwest, COVID. Overall, it was going up. Maybe starting to rise. One of those wonky drops. We'll have to see. Maybe starting to drop, I should say. It's one of those wonky drops at this time. RSV is low. Influenza A is low. Influenza B is low. HMPV and norovirus all low at this time. Now in the Northeast we go, and let's see what's going on for that. In the Northeast at this time, we do notice levels of COVID still high, but they're starting to drop. RSV, Influenza A, Influenza B, HMPV, all low at this time. Norovirus is also calculated at low at this time, and does look to be having a small drop, which is some good news. Let's take a look at a few more individual wastewater sites, and we'll come down here to what's going on in Jeffersonville, Indiana. Let's see what's going on there. Yikes. So Jeffersonville, Indiana, at this time is seeing a rise for COVID. RSV, Influenza A, Influenza B, and HMPV all low at this time. Norovirus, wow, that had a big rise. It peaked, now maybe dropping. Yeah, those norovirus levels are relatively high at this time, and no mpox detection at this time, which is some good news. Let's continue on out here to, how about Las Vegas? We haven't looked at Las Vegas in probably almost over a week. Las Vegas, Nevada, look at this. Your COVID levels have really dropped off. RSV is low, influenza A is low, influenza B is low, HMPV, norovirus, all low at this time, and no mpox. Wow, your wastewater site that's really some good news for you right now. Your levels of viruses are really low at the moment. So if you live there, or maybe you have to travel there, now is really not a bad time to do that. Let's take a look at what's going on in Atlanta, Georgia. And in Atlanta, Georgia area, this is the Clayton wastewater site. And we can see here, COVID is back down to low levels once again. That's good. RSV, influenza A, influenza B, not being detected for some reason. I don't know whether it's actually that low or it's just not showing up in the data. And norovirus is low, as is HMPV, and there are no detections of mpox at this time. Alright, let's take a look at New Jersey for today. New Jersey, 67 out of 70 hospitals reported, 466 hospitalizations. That comes out to 10 people on a ventilator. And in the discharges at this time, if we can get that to come up, how about we go to ICU instead? There we go. Discharges at this time, 62. And in the ICU, 54 patients are still there. New York State for today, 1,081 people tested positive, which, yeah, it's still over 1,000. I would like to see it get below 1,000. And overall, actually, I shouldn't be so down about this. New York State is actually dropping. They continue their drop. This is some good news. Would I like to see it drop faster? Sure. But hey, we'll take the good news. It's dropping. And you know what else is dropping? Their hospitalizations are dropping at this time as well. 1,057. I can feel it. They're going to get below 1,000 hospitalizations this week. They also have 107 people in the ICU at this time. Alright, going back to my site real quickly, I did add a couple of studies today. Lung function was one of them, and another one was that study about the kids. You know, long COVID can affect kids for up to 36 months. Let's face it, it could end up being longer than that because that's really as long as we know about. I mean, we're in 2024. COVID started back in 2020. If you want to see any study, if you're looking to find a study, right here, here's a whole list of them on my site. There's a whole bunch of different sections, and as new studies come out, I'll be adding them, and of course, if I find older studies, I'll make sure they get in there as well. And one of the things I have been doing lately, I gotta show this to you, this is important. I've been posting when a study has been published. So the one with kids, the recent one, well, I put September 2024. Didn't see an exact date, but if I see an exact date, I will post the date that the study has been posted. That way you know, is this something that's up to date, or is this something from back in the early days of the pandemic? Alrighty, folks, that does it for today's pandemic update. My website is datareport.info, where you can find all this information. And if you want to subscribe to my channel, hit that subscribe button down below. Give this video a thumbs up. Hit that notification bell. Share this video with anyone you know. And, of course, leave your comments down below. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Wednesday afternoon. Thanks for watching.